This is I-SUBI, lecturer from Immanuel Arasar College of Pharmacy. Today I am going to teaching about antipsychotic drugs. What is antipsychotic drugs? Antipsychotic drugs are medications mainly used to treat severe mental disorders involving psychosis, such as hallucinations, delusions, disorganized thinking, and agitation. They are most commonly prescribed for schizophrenia, but are also used in bipolar disorder, severe depression with psychotic features, and some behavioral disorders. Next, we have see about what is psychosis. Psychosis is a condition in which a person loses contact with reality. Symptoms may include hallucinations, hearing or seeing things not present, delusions, false beliefs, disorganized speech or behavior, severe agitation or aggression. Antipsychotic drugs help reduce these symptoms by affecting neurotransmitter in the brain, especially dopamine. These antipsychotic drugs are used primarily for the treatment of symptoms of mental disease. These are also called tranquilizer. They cause sedation without inducing sleep. They are essentially used in the symptomatic treatment of psychosis, such as schizophrenia and organic psychosis. The symptoms of schizophrenia can be divided into two types. They are positive and negative. Positive symptoms are those that are not normally found in healthy individuals, including hallucinations, delusions, and thought disorder. Negative symptoms represent the loss of qualities normally present in healthy individuals, including improvement of thought, blunted emotion, attention deficit, and lack of motivation or initiative. In addition, many of these drugs also act as skeletal muscle relaxants, anti-hypertensive, anti-emetics, and anti-epileptics. The long-term use of antipsychotics is associated with adverse effects such as involuntary movement disorder, gynecomastia, impotence, weight gain, and metabolic syndrome. Classification of antipsychotic drugs. Antipsychotic drugs are broadly classified based on their generation and mechanism of action into two main groups. First generation, it is called typical antipsychotics. These primarily block dopamine D2 receptor and are effective mainly for positive symptoms of schizophrenia. Subclassification based on chemical structure. Phenothiazines. It is classified chlorpromazine, trifluopracin, flufenacin. And butyrophenones. It is classified haloperidol, droperidol. Next, thioxanthines. It is classified two types of chlorprotixin, thiothixin. It is strong dopamine blockade, high risk of extrapyramidal side effects, mainly treat hallucinations and delusions. Next, second generation antipsychotics. It is called atypical. These block both dopamine and serotonin 5-HT2 receptors and treat both positive and negative symptoms. Example, clozapine, risperidone, olanzapine, quetiapine, aripiprazole, ciprasidone. And third generation antipsychotics, sometimes considered a separate group due to partial dopamine agonist action. Example, aripiprazole, brexpiprazole, cariprazine. Next we have say about chlorpromazine hydrochloride. It is one of the first generation antipsychotic drugs. It is one of the phenothiazine derivative. IUPAC name of chlorpromazine hydrochloride is 2-chloro-10-3-dimethyl methylamino-propyl phenothiazine hydrochloride. Molecular formula C17H19Cl N2SHCl. Key structural features: tricyclic phenothiazine ring, chlorine atom at position 2, side chain with tertiary amine. Uses of chlorpromazine is treatment of schizophrenia, acute psychosis and agitation, bipolar disorder, severe anxiety, control of nausea and vomiting, hiccups. Stability and storage. Light sensitive, should be stored in light resistant container. Stability and storage. Light sensitive, should be stored in light resistant containers. Air sensitive, may undergo oxidation. Moisture sensitive, keep in tightly closed container. Solution may turn pink or brown on exposure to light, air, decomposition. Stable in acidic medium but unstable in alkaline medium. It is one of the light sensitive, should be stored in light resistant containers. Air sensitive, may undergo oxidation. Moisture sensitive, keep in tightly closed container. Solution may turn pink or brown on exposure to light and air, decomposition. Stable in acidic medium but unstable in alkaline condition. It is formulated tablet, syrup and injection. Brand names are Dorazine, Largacetil, Hibernal and Megafen. These are the brand name of chlorpromazine drugs. Chlorpromazine hydrochloride is a phenothiazine antipsychotic drug. Works mainly by blocking dopamine receptor. Effective but has sedative and extrapyramidal side effect. Require proper storage to prevent degradation. Chlorpromazine hydrochloride is a phenothiazine antipsychotic. Works mainly by blocking dopamine receptors. Effective but has sedative and extrapyramidal side effects. Requires proper storage to prevent degradation. These are all the about chlorpromazine drugs. So, antipsychotic drugs are used primarily for the treatment of symptoms of mental disease. These are also called as tranquilizer. They cause sedation without inducing sleep. They are essentially used in the symptomatic treatment of psychosis such as schizophrenia and organic psychosis. The symptoms of schizophrenia can be divided into two types, positive and negative. Positive symptoms are those that are not normally found in healthy individuals, including hallucinations, delusions, and thought disorders. Negative symptoms represent the loss of qualities normally present in healthy individuals, including impoverishment of thought, blunted emotion, attention deficit, and lack of motivation or initiative. In addition, many of these drugs also act as skeletal muscle relaxants and hypertensives, antiemetics, and anti-epileptics. The long-term use of antipsychotics is associated with adverse effects such as involuntary movement disorders, gynecomastia, impotence, weight gain, and metabolic syndrome. Phenothiazines example promethazine hydrochloride, chlorpromazine hydrochloride, triflupromazine thioridazone, piperacetazine hydrochloride, prochlorperazine maleate, trifluoperazine hydrochloride. Ring another half phenothiazines, thiotixin, loxapine, succinate, clozapine. Fluorobutyrophenones. Example haloperidol, troperidol, risperidone, beta aminoketones, molindone hydrochloride, benzamide. Example வந்து sapride. Miscellaneous Raupe alkaloids. Example reserpidine. Propanediol. Example mepropamate. Oxypectin, quetiapine, serotinidol, and other opioids. Phenothiazines example promazine hydrochloride, chlorpromazine hydrochloride, trifluopromazine, thioridazine, piperacetazine hydrochloride, prochlorperazine maleate, trifluoperazine hydrochloride. Ring analog of phenothiazines is thiotixin, loxapine, succinate, clozapine. Fluorobutyrophenones, haloperidol, troperidol, risperidone. Beta aminoketones, molindone hydrochloride, benzamide, sulpiride, miscellaneous Raupe alkaloids, reserpidine, propanediol, mepropamate, carbamate. Example oxypectin, quetiapine, serotinidol, other opiates. Structure of chemical name of chlorpromazine is 3,2-chloro, 10 guys phenothiazine, 10 vial, 1 NN dimethyl propane, 1 amine. It is used to psychotic disorder such as schizophrenia, phase of bipolar disorder, as well as amphetamine induced psychosis. It's having some side effect. They are movement problems, sleepiness, dry mouth, low blood pressure upon standing, and increased weight. Side effects are movement problems, sleepiness, dry mouth, low blood pressure upon standing, and increased weight. Brands names are Thorazine, Largacetil, Hibernal, and Megafen. These are all about chlorpromazine hydrochloride. Psychosis is a condition in which a person loses contact with reality. Symptoms may include hallucinations, delusions, disorganized speech or behavior, severe agitation or aggression. It is antipsychotic drugs mainly block dopamine receptor. Okay, today class is over. See you next class. Thank you.